Hello everyone. Now I'm going to present it about my journal, my experiment with the title Temperature Effect on Plasma Heparin and Transaminase Activity in Children Blood with Tetralogy of Fallot. My name is Fitri Fadhilah. I'm from Study Program of Medical Analyst, School of Analyst Bakti Asi, West Java, Bandung, Indonesia. Here the abstract. Tetralogy of Fallot, or TOF, is a congenital heart disease that is caused by four heart defects, namely VSD, or overreading aorta, obstruction of the right ventricular outflow tract, and right ventricular hypertrophy. This abnormality, which affects the anatomic structure of the heart, causes poor oxygenated blood to be pumped out of the heart. Children have smaller veins than adults, which make obtaining blood sample much harder. An experimental design was utilized, which allows the researchers to manipulate one of or more variables and measure the resultant effect on the dependent variable. The population in this study was all vein blood sample of pediatric patients under the age of 10 in National Cardiovascular Center, Harapan Kita Jakarta with TOF. 11 samples were chosen randomly as the sample in the study. We took 3 milliliters of blood from each sample and give heparin. The samples were then stored for 30 minutes at 5 degrees Celsius, 22 until 25 degrees Celsius, and 37 degrees Celsius. We then used this sample to conduct ALT and AST tests. Based on the result of this test, we conducted descriptive statistical analysis, the normality test, homogeneity test, and ANOVA test. We found that there is no significant difference in the result of AST and ALT tests using the three different samples. This study aimed to examine the effect of different temperature on the volume of heparin plasma and transaminase activity in human blood with tetralogy of Fallot. The highest plasma volume was obtained from the sample that was put 30 minutes at 37 degrees Celsius. Okay, the introduction is about TOF. Like I said before, tetralogy of Fallot is a congenital heart disease that caused by four heart defects. This tetralogy of Fallot impact the children. As we know, children have smaller vein than adults, which make obtaining blood sample is much harder. It's more difficult, and of course, need many skill of the analyst to take the blood sample. The blood sample that we use in this study is heparinized vein blood. So after we took the blood, we put it on three kind of temperature. Yes, the temperature was 5 degrees centigrade or in refrigerator, and 22 until 25 degrees centigrade in room temperature, and 37 degrees centigrade in autoclave. After that, after the treatment, we test with hematocrit test. As known, the TOF sample is known that the hematocrit test is higher than a normal blood sample. So if the hematocrit higher, a higher number of red blood cell will cause a higher level of hematocrit and the otherwise. A low temperature may cause blood cell will morphological changes within the red blood cell, causing an increase the amount of erythrocyte. This is known as hemoconcentration of the blood. So the TOF sample had a higher hemoconcentration of the blood. The AST and ALT tests are usually performed with a serum sample. However, a plasma heparin sample can be used as a promising alternative as it can be prepared more quickly. The test can be performed earlier and the optimal temperature of enzyme to have its greatest catalytic activity is about 25 degrees centigrade. 25 degrees Celsius with the human body temperature at around 37 degrees Celsius. So we made an experiment based on that theory. Next is the methods. The population in this study was all fine blood sample pediatric patient under the age of 10 in National Cardiovascular Center Harapan Kita Jakarta with TOF. 11 blood samples were chosen randomly as the sample in this study. We took 3 milliliters of blood from each sample and gave heparin. The heparin sample was then put into 3 tubs with 1 milli each. Hemoglobin level, hematocrit, AST, and ALT were examined using photometric methods. All participants who fulfilled the inclusion criteria were enrolled in this study after their parents or legal guardians giving consent. The result of this experiment, as we can see, the hemoglobin and hematocrit levels in patients with TOF is high. The figure 1 in the left show that the hemoglobin level in patients with TOF is maintained above normal range. In this study, the average of level hemoglobin was 19.54 gram per deciliter. Figure 2 in the right show an increase in hematocrit level, with the average value of hematocrit in this study was 63.12%. The next result is the effect of temperature on heparin sample volume. As we can see in the picture, 3 tubs of 1 milli heparin sample were kept for 30 minutes at 37 degrees Celsius, 22 until 25 degrees Celsius, and 5 degrees Celsius. Pictures show that the highest increase of heparin volume happened at 37 degrees Celsius. Next is the result of transaminase enzyme concentration using heparin plasma at a different temperature. The graphic above shows that in the left, the AST activity using heparin sample were achieved optimally at 37 degrees Celsius. Besides, on the right, ALT activity using heparin sample were achieved optimally at 37 degrees Celsius and keep stand for 30 minutes. So here the discussion. Tetralogy of Fallot or TOF is a rare congenital heart disease that is caused by 4 heart defects, namely VSD, overreading aorta, obstruction of the right ventricular outflow tract, and right ventricle hypertrophy. This abnormality, which affect the anatomic structure of the heart, cause poorly oxygenated blood to be pumped out of the heart. This will eventually cause dyspausia and calcinosis. As previously mentioned, blood investigation is conducted frequently in patients with TOF, which most of them are children. Children have smaller veins than adults, which make obtaining blood sample much harder. In addition, high hematocrit level in blood means a lower quantity of plasma or serum that can be obtained. Therefore, a blood sample drawn should be used effectively. This study has proven that the volume of heparin plasma sample can be affected by the given temperatures. The optimal temperatures for most enzyme range from 0 to 40 degrees Celsius. Very temperature may cause the enzyme to denature and lose its catalytic function. Similarly, very low temperature may cause inactivity of most enzymes as the energy of the cellular reaction is insufficient. As previously mentioned, our study used venous blood sample added with heparin anticoagulant. The sample were then stored for 30 minutes at 5 degrees Celsius, 22 until 25 degrees Celsius, and 37 degrees Celsius. We then used the sample to conduct ALT and AST tests. Based on the result of this test, we conduct descriptive statistical analysis, normality test, homogeneity test, and ANOVA test. We found that there is no significant difference in the result of AST and ALT test using the three different samples with signification more than 0.05. So the conclusion is this study aimed to examine the effect of different temperature on the volume of heparin plasma and transaminase activity in human blood with tetralogy of Fallot. The highest plasma volume was obtained from the sample that was put 30 minutes at 37 degrees Celsius. ANOVA test of the AST and ALT results show no significant difference in the activity of AST and ALT in all of the sample in this study. Thank you for your attention. See you again on another presentation.